Hello, I'm Mr. Sudip, consultant vascular surgeon, and I'd like to discuss deep vein thrombosis, or DVT. These affect about 1 in 1,000 of the population, and so are relatively common and important to recognise, as they can cause problems with leg function and even to life. However, if the condition is detected and managed early, then it may only be a minor inconvenience which only requires lifestyle adjustments with or without ongoing medication, and from which a full recovery is possible. What are the causes of DVT? The DVT will occur when the blood congeals into an abnormal clot within a deep vein, usually but not always in the leg. This can occur for one of the following 3 reasons. 1, there is damage to the vein from prolonged pressure or an injury to the leg, such as surgery or following a fracture. Number 2, if the blood flow in the vein is much slower due to lack of movement in the leg over a prolonged time, such as a long-haul airplane journey. And number 3, the blood itself is much thicker and sludgier than normal, maybe due to dehydration, smoking, hormone therapy, or sometimes an inherited abnormality of clotting. Sometimes more than one of these 3 factors may be involved. A good example being travelling very long distance in a cramped seat following a leg injury and not drinking enough fluids. Occasionally there is no obvious cause for the DVT. What are the symptoms of DVT? If a DVT is small, it may cause little or no leg pain, but if it gets bigger, then the patient may notice swelling of the leg or calf, bluish discoloration, and increasing pain. They usually only affect one leg, but the most worrying symptom is if a patient gets chest pain or breathlessness, which suggests that the clot may have broken off and travelled to the chest vessels. How do you diagnose a DVT? If someone has a suspected DVT, then it's important to get a quick diagnosis using a blood test and simple ultrasound scan, usually available at a local clinic or hospital, and then get appropriate treatment. In some cases, during investigation, another cause for leg pain is found, in which case that can be managed as appropriate. How do you treat a DVT? Well, if the DVT is confirmed, then the patient is usually given immediate blood thinning medication, which will stop the condition progressing and usually allow the clot to be dissolved over the next few weeks. This anticoagulant medication is usually given for a period of 3 to 6 months, but can be given longer if there is a higher risk of getting future DVTs. At the same time, it's important to address lifestyle factors such as stopping smoking, losing weight and increasing activity where necessary. It is very rare to require infusions such as clot-busting medication or surgery for a DVT. Sometimes a compression stocking is all that is needed as well as the medication, especially if the leg is swollen or the skin is affected. And what is the long-term outcome of a DVT? Well, if it's diagnosed and treated when it's small or confined to the calf, then there's every reason to expect a full recovery. If it's larger or associated with other medical conditions, then it's always worth getting advice of a haematologist or vascular surgeon to achieve optimal leg function and prevent further DVTs. Thank you.